From this, there are different circulation, regional circulation. Out of this, we have already discussed about, we have completed coronary circulation. Okay. So today I will be covering cerebral circulation. This circulation you must know because the CVA, cerebrovascular attack, or commonly we known as stroke, it happens because of this problem in the cerebral circulation. So you must know about this first, normally how this circulation is made and what are the problems of this. That is the applied aspect is stroke. And from this, so what we will be learning? We will be learning blood supply to brain. That is the anatomy of cerebral circulation. What are the cerebral arteries? How circle of Willis is formed, and the arteries, how they are supplying different parts of the brain. We will also be learning, this second part is very important. What is this? These special features of cerebral circulation. You can expect question, short question, as what are the special features of cerebral circulation. And the third part also important for your exam, that is factors regulations of cerebral circulation. Means what are the factors that affect cerebral circulation. And finally, what is stroke, what are the different kinds of stroke, what are the signs symptoms of stroke, how this can be managed, what are the causes of stroke. So let us start with, see, our brain is one of the very vital organ. When our brain doesn't function, that means we are dead. So finally dead is declared when we didn't say or find any function of the brain. So then only brain death. We regard it as brain death. That is, the person is dead. Heart activity may not be there, but very feeble heart activity may be there. But if there is no brain activity, the person will be declared as dead. Okay, EEG can be performed, and this EEG will be saying whether the brain is functioning or not. So, vital organ, and it performs various important functions, vital functions. And since it has to perform various functions, it needs what? It needs energy. Where from this energy will come? It will come from oxidation of nutrients. And importantly, our brain cells, they can only use glucose as the nutrients to derive their energy. So, glucose is the main nutrient from which energy is made available to the brain tissues. And we know glucose can give energy in two ways, anaerobic ways and aerobic ways. But our brain cells, they cannot give us energy through anaerobic pathway. They are capable of producing energy only by aerobic process. So, since the ATPs are produced by aerobic sources, that too from glucose, so we have to ensure for its activity, it is these both components, means oxygen and nutrient, glucose, is supplied adequately to the brain. Our brain tissue requires 3.5 ml of oxygen every minute per 100 gram of brain tissue. It is more than other tissues. Since it performs even when we become asleep, brain continues to function. So for this reason, brain requires much energy. You will find AV difference. One artery is supplying the brain, and another vein vessel will be bringing the venous blood. And if you check the AV difference of oxygen, you will find per 100 ml this difference is 6 ml. Whereas in other tissues it is 5 ml. That is, brain tissues are extracting more oxygen per 100 ml of blood. So we can see for performing the brain activities, proper, who will supply this oxygen and the nutrients? Blood. So every moment there should be adequate supply of blood flow. There should be adequate blood flow. And it is done by the cerebral circulation. And you know, if you block the cerebral circulation for only 5 seconds, the brain cell or the person will become unconscious. Only. It cannot tolerate anoxia for more than 5 seconds. So when anoxia will be seen, when blood supply will be inadequate, no blood supply to the brain, means no supply of oxygen, means no ATP is produced, means the brain cells will not be acting. And if you suspend oxygen supply to the brain tissues for 5 minutes, then what will happen? The brain cell will die. And this damage is irreparable. It cannot be reverted back. So 5 minutes of short supply of oxygen or short supply of blood to the brain tissues is not acceptable to the brain. So adequate supply of blood supply has to be maintained. So this is done by cerebral circulation. The brain tissues consume 3.5 ml of oxygen per 100 gram per minute. Now let us see the anatomy of cerebral blood flow. Have you studied circle of Willis in anatomy? Brain anatomy not yet studied? Okay. Brain is supplied with 2 main arteries. One is this basilar artery. This basilar artery is formed by 2 vertebral arteries, left and right. They join together and form basilar artery. And 2 internal carotid arteries. From aorta, carotid artery, it is bifurcated into internal carotid artery and external carotid arteries. These internal carotid arteries enter into the brain. So these are the right and left carotid arteries. Now this one and this one, these are actually formed by these 2 vertebral arteries, and this is the basilar arteries. Now these basilar arteries and these 2 internal arteries, they anastomose. They anastomose, join together. Okay. And a circle is produced. There will be connection. There will be connecting braces, anastomotic channels, connecting these and these and that one. And a circle will be produced. This is called circle of Willis. So what are the 2 main arteries that is supplying the cerebrum? One is the basilar artery. It is formed from 2 vertebral arteries and 2 internal carotid arteries. Now they will join together and form a circle. This circle is called circle of Willis. You may get short question. What is circle of Willis? At the base of the brain, you will get the circle of Willis. Now from the circle of Willis, we will get 3 sets of arteries will come out. One is anterior cerebral artery, and these are posterior cerebral artery, and these two are middle cerebral artery. Now these three sets of arteries will pass along the surface of the brain and pass through the pia mater. And while passing through the pia mater, they will produce branches. And these branches will enter within the brain tissues. They will penetrate into the brain tissues, and these are called penetrating arteries. So these penetrating arteries are actually originating from these three sets of cerebral arteries. They will be passing through the pia mater, through the surface of the brain tissues, and from these the several arterial branches will be formed. They will enter within the brain tissues. As, what is the name? Penetrating arteries. Penetrating arteries. So this is one of the penetrating. See, this is the artery, pial artery, pia mater, artery in the pia mater originated from cerebral artery. So now it will produce branch. This branch is entering within the brain tissue. Now see, this is the capillary. This is the capillary. So many things are there around the capillary. Hari Baba, what are these? So one is glial cell. There are different kinds of glial cells. In the brain tissue, there are different kinds of glial cells. One glial cell is astrocytes. And these astrocytes are having food processes. Some extending parts are coming out of the cell. These are called food processes. Now these food processes will encircle the capillaries. So you can see these food processes of the astrocyte are encircling the capillaries. Moreover, around the capillaries there are some pericytes. So these are the pericytes and these are the endothelial cells. Now here the endothelial cells is different from other body parts, other capillaries. What is the difference? Here you won't get fenestration. No fenestration is there, no slit is there. So large molecules cannot enter from the blood vessel into the brain tissues. Okay? And the basement membrane of these endothelial cells are also thick. So this thick endothelial basement membrane without no fenestration and astrocyte, food processes of the astrocytes and the pericyte all together, they form one thing. That is, you might have heard, blood-brain barrier. Because of this blood-brain barrier, the toxic substances present in blood, any virus, any organism, they cannot penetrate from the blood into the brain tissues. So these are very preventive in nature. It prevents, this blood-brain barrier prevents toxicity, the toxins present in blood entering from, and they prevents entering of this toxin from blood into any organisms from here to there. Okay, so this is the main functions of the blood-brain barrier. Okay, so what is blood-brain barrier? What are the functions? How it is formed? Where it is seen? So you are now it is known to you. Moreover, these cells, astrocytes, they also produce some chemicals. These are actually end products of the astrocyte. What are these end products? And these end products are vasodilator. See, around these, there are smooth muscles. These are the smooth muscles. When these vasodilators are released, these smooth muscles are contracted. Dilated. So blood flow is increased. these smooth muscles will be dilated, so diameter will be increased, so more blood will be entering, means more blood flow will be there. So what are these metabolites secreted from this? These are potassium ion, adenosine, metabolites and products of arachidonic acids, okay, and and what I said, calcium, adenosine. So these are the some end products, and all these end products are vasodilators. So when these are secreted, the blood vessels, that is this penetrating arteriole, becomes dilated and more circulation is made to the brain tissues. Now from these arterioles, the brain gets its metabolites, gets its nutrients, vitamins, whatever needed, ions, and also the glucose. Now see, the anterior cerebral artery supplies this part of the brain, and the lateral, means middle cerebral artery supplies this part, and the posterior cerebral artery supplies the posterior part of the brain, this part of the brain. So when one of these artery is blocked, what will happen? If it is posterior artery, cerebral artery is blocked, this area will not get oxygen, and so this area will be damaged. So the function of this area will not be there. So this will be reflected in the patient. Similarly, these areas are also performing different functions. So if these are also blocked, these vessels are blocked, then the functions of this area will also be disturbed. Now, these are the important aspect for your examination. What is this? Salient features or special features of cerebral circulation. Number one, the cerebral CBF means cerebral blood flow. How much blood is flowed to the brain? 50 to 65 ml per 100 gram of brain tissue per minute. This is their demand. When this amount is supplied, the tissues will get 3.5 milliliter of oxygen, and it will also get adequate amount of glucose to derive its energy. Okay. For entire brain, what is the demand? 750 to 900 ml of blood. What is our cardiac output? 5 liter. So what percentage of this? It is about 15% of total cardiac output. And its weight is brain, you know the weight of the brain tissues? 1.4 kg. So for 1.4 kg, or this mass of cardiac output is needed. That means this area is how much it is active. It is reflected by this. Okay. There are two separate circulations we have seen. One is through basilar artery, another through internal carotid arteries. They form the circle of Willis. From these cerebral arteries, anterior, middle and posterior cerebral arteries originated, and they supply the brain tissues. Cerebral arteries are end arteries, means they will not form. Only anastomosis channel is you will get only in circle of Willis. But when these fibers, these arteries are entering to the brain, they don't form any anastomotic channel. That means these arteries are end arteries. Okay. Capillaries in brain are non-fenestrated. I already told they are non-fenestrated. And there is close capillary neuronal proximity. This is not available. See in the previous diagram, this is neuron, this is the sinus, very close to the capillary. In other tissues, in other organs, you would find this sort of close proximity of the neurons to the capillaries. So this is another Important features. Capillary neuron proximity. Coronary blood flow is closely coupled to metabolism. If the metabolism is metabolic demand of the brain, suppose during your exam, your activity is very high. Suppose when you are fighting with somebody, your activity is very high. In that case, what is? Brain requires more blood. Okay, so there will be more metabolism. So more metabolism means more oxygen will be required and more end product will be produced. And these end products are actually vasodilators. They will dilate the blood vessels. So more and more blood will be supplied to the brain. Could you follow this? Right? Okay. So that's why we are telling CBF is closely coupled with metabolism. Higher the metabolism, higher will be the flow. Lower the metabolism, during sleep it will be less. Now, during activities it will be more. And during activity, when you will, the brain tissue will be working more, means more metabolites will be formed, and these metabolites are vasodilators. So they will dilate the blood vessel so that more and more blood can enter within the brain and supply the requirements. CBF shows wide regional variations. Say basal ganglia, its demand is much more. The frontal cortex, its demand is much more. So, depending on the activities, the demand for oxygen is much more. So, when this part showing most activity, they require more oxygen, they require more blood supply. Okay? Cerebral circulation shows autoregulation. You will find also autoregulation in coronary circulation. Okay? And in skin, in muscles there is autoregulation. So here also we will find autoregulation. Means, what does it mean? The pressure, blood pressure, mean arterial blood pressure. If pressure is increased, the flow should be increased. If pressure is decreased, flow should be decreased. But here, because of autoregulation, if blood pressure is decreased to 60 or increased to 160, no matter. In both the cases, the flow will be constant. It will maintain this pressure, this flow. When the pressure coming down to 40 millimeter mercury arterial pressure, so 60, so not 40, 60, even in that low pressure, the cerebral blood flow will be maintained in the brain. When the pressure is increased to 160 millimeter of mercury, even during that period, blood flow will be maintained. And what is the amount will be there? Amount of blood flow will be there in such case. So what is the range? So where you will find autoregulation. So this is the range, 60 to 140 millimeter mercury. In between this systemic blood, in the blood pressure in the arteries, the blood flow will remain same, will be constant. Another thing, very important, number 9. So what is this? Cushing's ischemic reflex aims to ensure cerebral blood flow in face of large increase in intracranial pressure. Intracranial pressure. Within the brain is a box. Okay? What is there? 3 things. Brain tissue, and one fluid is there. CSF, cerebrospinal fluid, and blood vessels containing blood. These are the 3 constituents in the brain, main constituents. And the sum of these 3 constituents is constant. This is the skull. So within the skull, what is there? CSF, blood, and brain tissues. And in these, CSF and brain tissue, they cannot be compressed. So their amount is fixed. You cannot increase the brain tissue, you cannot decrease the brain tissue. Similarly, CSF quantity is also fixed. You cannot increase it, you cannot decrease it. But this blood, we can increase it or decrease it. The pressure within this skull is exerted by this and this. And sum total of this pressure must be same, must be constant. If it is increased, we call it increase in intracranial pressure. Pressure within the cranium is increased and it will produce lot of symptoms. Starting from headache to reeling of head, so many things. Okay? So we can increase and decrease the pressure within the skull, within the brain by increasing and decreasing the flow of blood. This is the only or because all other two components are not compressible. But this is compressed. Here the blood is within the blood vessels. So if you constrict the blood vessels, then less blood will be created. Suppose ICP, intracranial pressure has increased. So in that case, what I will do? I will compress the blood vessels. So less blood will be there in the cranium. So pressure within the skull will come to normal. And if ICT is reduced, then what will happen? The vessels will be dilated. Some more blood will be coming. And again, the ICT pressure within the brain will be maintained. So in this way, by constricting the blood vessels in the brain or dilating the blood vessel, we can balance the intracranial pressure. Intracranial pressure may be changed in various conditions other than this. What are these? Number one, tumor in the brain tissue. More cells, so it will create more intracranial pressure. Okay, and produce signs symptoms. Increase in CSF, cerebrospinal. These cerebrospinal fluids are accommodated in where lateral ventricle, third ventricle, fourth ventricles. These are filled up with, and within the spinal cord there is central canal. Within the central canal there is CSF. So if the amount of this CSF is increased in the brain, so the pressure in the skull will also be increased. Intracranial pressure will be increased. So increase in CSF pressure, increase in tissue, brain tissue by, for example, tumor and other things. If one of the blood vessel is torn, damaged, what will be there? Oozing of blood from the blood vessels into the brain, and it will increase the pressure within it will increase the intracranial pressure. So in cerebral blood vessel, when these are ruptured, so a lot of blood will be coming out, and this will increase the ICP, intracranial pressure. So these are the different conditions by which, but we have a mechanism. By that mechanism, if there is increase in intracranial pressure, the mechanism will bring down the pressure. If the pressure is reduced, the mechanism will increase the pressure so that the pressure within the cranium remains constant. So number 9 point, Cushing ischemic reflex. I will show this reflex. Cushing ischemic reflex aims to ensure cerebral blood flow in the face of large increase or decrease in the intracranial pressure. So this Cushing reflex will manage. If pressure is increased, it will bring it down, this reflex. If it is below the level, pressure is low, below 20 millimeter of mercury, then Cushing reflex will come into action, it will increase the intracranial pressure. When it is more, the same reflex will bring it down to normal. Okay. So this is another characteristics, important features of cerebral circulation. And number 10 points, that is presence of blood-brain barrier. What is blood-brain barrier? I have already discussed. So this is a protective thing, is in other areas you won't find this. Vesicular transport is less developed. No vesicles from, we have seen some products from outside the capillary is entering within through endocytosis, and some products are coming out of the capillaries through exocytosis. This sort of thing you won't find here in these capillaries. So this is another feature. And blood-brain barrier provides protection to the brain from the toxic and harmful substances circulating in the blood. Blood-brain barrier is disrupted when brain is infected or it is inflamed and there is brain tumors. Now, we have finished the specialties of coronary cerebral circulation, special features. Now, regulation of cerebral blood flow. So, there are 4 ways by which blood flow is regulated. What are these? Auto-regulation, important for your examination. Auto-regulation of cerebral blood flow, short note. So, neural factor, there are auto-regulation is one of the factor that regulates cerebral blood flow. Another is neural factor, others is chemical factor and intracranial pressure. Okay. So, let us discuss auto-regulation. What is auto-regulation? Like any other organ, brain also regulates its own blood flow by means of auto-regulation. Cerebral blood flow remains relatively constant with a perfusion pressure range of 60 to 140 millimeter of mercury pressure. Already I told this. Okay. However, the auto-regulation in brain has got its own limitation. So, it can regulate within this pressure range. Beyond this pressure range, they cannot control. So, for that purpose, another controlling mechanism is required. So, auto-regulation depends on these 3 factors. What are these? Effective perfusion pressure, cerebrovascular resistance, and the intracranial pressure and CSF pressure, cerebrospinal fluid pressure. So, these are the factors that affect auto-regulations. What is the effective perfusion pressure? This is the, suppose this is one organ, say spleen. So, one artery is supplying this and the vein is coming out of this. So, what is the difference, pressure difference between this? This is the perfusion pressure, the difference. The effective perfusion pressure is the balance between the mean arterial pressure and the venous pressure across the organ. Understood at this point? What is perfusion pressure? Divided by resistance. So, what is the AB difference, arteriovenous pressure difference and divided by the resistance. That will determine effective perfusion pressure. Since venous pressure is 0 in brain, so it is the arterial pressure, it is the mean pressure that will determine, and the resistance, it will determine which resistance flow is inversely related, and with perfusion pressure is directly related to arterial blood pressure. Okay, so it is directly related, and with resistance it is inversely related. Okay, and this is the pressure range. Auto-regulation fails beyond this range, as I discussed. Now, cerebrovascular resistance. What are these cerebrovascular resistance? There are 3 cerebrovascular resistance. What are these? One is intracranial pressure. What is intracranial? I have already discussed. Intracranial. Next is CSF. So there are hydrocephalus. Have you heard this name? Big head, filled up with water. Hydrocephalus baby. Big size head means they are in the lateral ventricles, third ventricle, fourth ventricle filled up with lot of CSF. So because of more CSF, so what is there? There is increased blood pressure. But in such babies, the brain tissues are released. So it is compensated in that way. See, if one out of these 3, if one is increased, because it has to maintain the constant pressure. So if one is increased, this has to be, this is balanced by the other 2. So if one is increased, other should be decreased. So in that way, cerebrospinal fluid also causes resistance and viscosity. can you name a blood condition which increases viscosity? Anyone? Can you name the condition in which the RBC count is increased? Polycythemia. More blood cells, RBCs in blood, means blood is more viscous and viscosity is a resistance. So if the blood supplying the brain is having more viscosity, it will create resistance to blood flow. So there will be less blood flow. So in the polycythemia patient, they will be having low cerebral blood flow. And opposite to this is seen in anemia. In anemia, there is low blood count, low blood cell, less number of blood cells, means viscosity is low, means resistance is less, means there will be more supply of blood to the brain. Right? Could you follow this? Follow this? So sequence, this is the difference occasions. Viscosity, cerebrospinal fluid curve, intracranial pressure. So let us talk about intracranial pressure. So this is the reflex. Question may ask, what is Cushing reflex? What is its function? Its function is to maintain the pressure in the, that is intracranial pressure. How it maintains the intracranial pressure? Or the blood flow, increase intracranial pressure. When the pressure within the cranium is increased, what happens? Pressure within the cranium is increased. Since brain tissues are not compressible, CSF is also not compressible, blood vessels are compressible. So if the pressure within the cranium is increased, the blood vessels will be compressed. If blood vessel is compressed, what will happen? There will be decreased flow of blood, decrease in cerebral blood flow. As a result, what will happen? The brain is also having medulla, which is controlling blood pressure. Means here we have vasomotor center, vasoconstrictor area. So now what will happen? This vasoconstrictor area or vasopressor area will be activated. This is present in medulla. They will be activated. Activation of this will cause peripheral vasoconstriction. So activation of these, the blood vessels in the periphery will be contracted. There will be vasoconstriction. Now all this blood, where it will go? It will go to the brain. Okay. So increase in arterial blood pressure. So increase in intracranial pressure usually caused what? Decrease in cerebral pressure. Now because of this reflex, see again there is increase in blood pressure and restoration of cerebral blood flow. Similarly, if CSF pressure is increased, same thing will happen. So restoration of blood flow can occur because of this Cushing reflex. Important for your exam purpose. Another question may be asked. Write it down. This Monroe-Kelly doctrine may be asked for MCQ as MCQ. May be asked for as short question. What is this Monroe-Kelly doctrine? What it says, according to Monroe-Kelly doctrine, as I already told about this, as the brain tissue and CSF are non-compressible, so sum of the volume of blood, CSF and brain tissue in the cranium is always constant. I have to maintain this pressure constant. But the two things are not compressible. So only I can maintain by altering the blood. Either more blood has to be supplied to the cranium or less blood to be supplied to the. When pressure is increased, I will supply less blood. When pressure within the cranium is less, then I will supply more blood by those reflex. So that is Monroe-Kelly doctrine. Hypothesis. Doctrine means hypothesis. Okay. As the volume of brain and CSF are constant, any increase in intracranial pressure, any increase in intracranial blood flow tends to increase ICP. I told you already this thing. These are already discussed. See, when you are, two important things, the last 2 points. Last 2 points. When body is accelerated upwards, you are in a rocket going to moon. Okay, so you are going against gravity. So in that case, what happens? The blood from your upper part will be accumulated in the. So from the upper part, blood will be accumulated. So in the cranium, what will be there? In the pressure will be reduced. Less blood is coming into the cranium, so pressure will be reduced. Now by activating that reflex, this will be dilated. So now more blood can be enter into the cranium. This way it can be. And similarly, when you are coming down, say what is this called? From airdrop, diving, okay, in air. So this will cause what? Accumulation of blood into the upper part, into the brain. More blood is going. So this more blood is coming into the cranium. That means within the cranium pressure will be more. So they will compress. This increased pressure will compress the blood vessels. As a result, more blood cannot enter into the brain. Less blood will be entering into the brain. So pressure will be maintained. So when ICP, increased ICP, intracranial pressure, what are these causes? What are the causes of increased intracranial pressure? See, these are the bleeding into the brain, swelling in the brain, aneurysm. Aneurysm means swelling of blood vessel arteries. In the mainly brain, it is seen in circle of Willis, in the vessels of the circle of Willis. So there is aneurysm, and these are very dangerous. Anytime it can burst and cause bleeding into the brain. The patient may die immediately. Well, since these are bigger arteries, so the patient may die in such case. Okay. So aneurysm is another cause. Blood vessel is increasing, so size is increasing. Okay. As a result, pressure within the cranium will be increased. Brain tumor, infection such as encephalitis, meningitis, it will increase intracranial pressure. Head injury, bleeding will be there, so that will increase the pressure within the cranium. Hydrocephalus, as I mentioned, hydrocephalus, and high blood pressure also cause all the blood pressure are dilated, so high blood pressure will be there. Stroke. 2 kinds of stroke we will see. One is ischemic stroke, another is hemorrhagic stroke. I will explain. Symptoms, how you know that intracranial pressure is increased? Headache, blurred vision, feeling less alert than usual, vomiting, changes in behavior, and weakness or problems with moving or talking, and lack of energy or sleeplessness. Okay. Treatment, no need. So, see, this is aneurysm, swelling of artery. Okay. This is aneurysm. This is called aneurysm, swelling of the artery. And this is hydrocephalus. These are the lateral ventricles, third ventricles. So here, this is normal, and here see the fluid CSF is increased, as a result cranial pressure is increased. So this is hydrocephalus, and here see 3 kinds of brain strokes the patient may face. One is hemorrhagic, blood vessels tear, so blood is coming out of the vessels. Here what happens? One embolus or is blocked, the blood vessels, no blood can pass through. So as a result, this area of the brain will not get any blood supply, no oxygen, this area will be necrosed, will be dead. Another is atherosclerosis. So here blood vessels become narrowed because of accumulation of atherosclerotic plaque. So this plaque ultimately, finally it will be it will be blocking the blood vessels, so no blood will be coming because of this atherosclerosis, and it will result in atherosclerotic brain stroke. Viscosity already said. Neural factor, blood vessels are supplied with sympathetic nerve fibers. So when sympathetic nerve is stimulated, the blood vessels will be contracted, and so what will be the pressure will be rising. So that way it can affect the cerebral blood flow. Chemical factors. There are important. One is carbon dioxide, another is hydrogen ion, and low oxygen level. These are the three main factors that chemically control cerebral blood flow. Hydrogen ion, it is formed from what? Lactic acid, or also it may form from carbon dioxide. How? Carbon dioxide plus water, H2CO3. Now it will be dissociated. Hydrogen ion plus bicarbonate. So this way hydrogen ion concentration will increase. This hydrogen ion is a vasodilator. They will cause vasodilatation of the blood vessels in the brain. So there will be increased blood flow. They can increase the blood flow. Similarly, high partial pressure of carbon dioxide. When partial pressure of carbon dioxide increased beyond 35 millimeter of mercury, that may cause vasodilation. Also, oxygen. When oxygen level or oxygen, the blood supplying the tissues are having less oxygen in the blood. Suppose it happens in anemia. So it will supply less oxygen to the brain tissue. Also it happens in hemorrhage. Lot of blood is lost because of hemorrhage. Then what will be? Hemorrhagic shock will be there because less blood will be coming to the brain. So less blood flow will be there, and that way the circulation, cerebral circulation can be affected. Last point, metabolite secretion from astrocyte. What are these? Nitric oxide, potassium ion, metabolites of arachidonic acid, adenosine. They are all vasodilator. Okay, so when the astrocytes will secrete this thing, then what will be vasodilation? There will be increased blood flow. Stroke. What is stroke? Go through it. Remember it, write it. Stroke, also called cerebrovascular attack. Accident. Cerebrovascular accident. CVA. In short, we will be telling CVA. It is a syndrome. It is a syndrome, multiple symptoms. Syndrome of rapid onset of neurological deficit. Means neurological, there will not be neurological function. There will be loss of neurological function suddenly. Why? Because of involvement of a blood vessel in the cerebral circulation. Okay. And something is happening within the blood vessels. Because of these changes in the blood vessel, what you will see? Rapid onset of neurological deficit. Now, what are the changes in the blood vessel? What changes can be taking place that will initiate stroke? Stroke is the sudden death of neurons in localized area of the brain. It may happen here, it may happen here, it may happen here, it may happen here. Any part of the brain. Stroke is the sudden death of the neurons in the localized areas of the brain due to inadequate supply of blood, means inadequate supply of oxygen and nutrients. It is characterized by, if the lesion is less, it may be reversible. If the lesion is more, then it is irreversible or irreparable. There may be partial paralysis. If damage is done here, the opposite part of your body will be paralyzed. One is ischemic stroke, another is hemorrhagic stroke. Both will involve blood vessels. Both will involve blood vessels of the cerebral blood vessels. In ischemic stroke, what happens? It occurs due to interruption of blood flow to a part of the brain. How interruption is made? By a thrombus. Thrombus means blood clot. So locally, in that particular area of the blood vessel, a thrombus may be formed, and this thrombus may close the lumen. So no blood will be passing through. And so this part of this, the part supplied by this vessel will not be getting oxygen blood, so that will be necrosed. Okay, so this is by thrombus. Another cause may be formation of embolism, embolus. What is embolus? Cerebral blood vessel is here and embolus is formed here. What is embolus? It may be a part of the clot. Here one blood clot is formed, and this clot is going through these arteries to the brain, and ultimately it will block a blood capillary, so that part will be affected. No blood supply will be there. So this is also embolus. Another, that is a part of the thrombus originated from, not locally, from somewhere else. It is coming from some. Embolus always comes from somewhere else. It may be gas. It may be gas, bubble. When the drip is given, if air is entered in the vein, there is a chance of formation of embolus. There is a chance of formation of embolus, and that may choke some blood vessels, particularly if it can block, if it is able to block a blood vessel it may cause stroke. So that is also very threatening. Okay. And another thing is atherosclerosis. Suppose this is the coronary artery. Here atherosclerosis is there. In the inside there is atherosclerosis. Some plaques is removed from this plaque. Now it will be traveling through the blood, and it will coming to the brain, and it will choke some blood vessels. As a result, that area will face stroke. That is, this sort of stroke is called ischemic. Ultimately, by occluding the vessels this way, either by thrombus or by embolus, is called ischemic stroke. So another is hemorrhagic stroke. So this is simple. There will be rupture of the blood vessels. There will be rupture of the blood vessels because of increased pressure or because of accident, mechanical injury to the brain. So blood vessels will be teared. So blood will be coming out of that area. That now there will be increased intracranial pressure, as well as some part of the brain will not be getting oxygen and blood. So there will be necrosis of those tissues. Okay. Now the pathophysiology of CBA. Right. First, there is thromboembolism, either because of thrombus or because of embolus. What will be there? There will be flow will be obstructed, and there will be hypoperfusion, less blood flow to the affected area. As a result, that area will not get oxygen, will not get it, so less ATP production will be there. Since ATP production is there, less ATP depletion is there, it will cause activation of certain enzymes. What are these enzymes? These are peroxidase enzymes, protease enzyme, nitric oxide synthase enzymes. So there these enzymes will be activated. Now they will cause destruction of the brain cells, internal organelles, cell membranes. So because of this, all cells are died. So because of this, there will be what? Liquefaction. That will be converted into liquid. The cells will be converted, and on CT scan or MRI, a mass will be fluid filled mass you will observe. So that is the pathophysiology of stroke. If I am giving you this, get the picture of this. So this is the hemorrhage. In CT scan, it will appear like this. The hemorrhage. Factors of CVA. What are the factors that causes CVA? These are the factors. Heart disease, hypertension, high cholesterol in blood, they will call atherosclerosis, high blood sugar level. So blood sugar, those who are having diabetes, they are to suffer three diseases. One is cardiac disease, stroke, renal disease, and retinopathy. Another is numbness of the neurosis. Heavy smoking, heavy alcohol consumption. So these are the factors that is associated with CVA. The causes of CVA: thrombus, I already explained, thrombosis, embolism, hypoperfusion. Hypoperfusion means there is blood loss. So instead of 5 liters of blood, I have lost 2 liters. Only 3 liters blood is circulated through. So less blood will be coming. So there will be hypocirculation in the brain. So that will may cause also CVA. And hemorrhage, same thing. Out of these 4, the most common cause is embolism. What is embolism? I said it may be a part of atherosclerotic plaque. It may be gas. It may be a gas, or it may be part of atherosclerotic plaque. Okay. And also blood clots. Symptoms. So there will be dizziness, initial symptom dizziness, loss of consciousness, coma, or death. Other features: weakness, numbness or paralysis, particularly to one side of the body, impairment of speech, emotional difficulties, loss of coordination, and loss of memory. So in addition to this, if the patient survives, these are the symptoms, these are the complications will reflect. Aneurysm already I told. Most common site of aneurysm. Thank you.